You may think stroke is something that simply happens, a sudden event, unpredictable, arriving without warning. Most people over 60 carry that belief without ever questioning it, but doctors see something very different. In the vast majority of cases, stroke is the final visible result of a process that has been building quietly inside the body for months, sometimes years, driven by specific, identifiable factors. Factors that in many cases can be genuinely addressed before they reach a critical point. And here is what makes that truth so powerful. It means that what you do this week, the choices that feel small and ordinary and unremarkable, are actively either building toward that risk or quietly reducing it. Every single day. That is not reassurance. That is biology. You are not alone if no one has ever explained it that way. Most people over 60 are handed a prescription and a pamphlet. Today I want to give you something more valuable than both. Stay with me through all 5 strategies, because what connects these to the actual biology of stroke prevention is more direct than most people have ever been shown. Let us begin with the one factor that sits at the foundation of stroke risk more than any other. Have you ever wondered why doctors check blood pressure at every single appointment, even when you came in for something completely unrelated? Even when you feel perfectly fine? Because high blood pressure causes damage that produces no symptoms whatsoever until that damage has been accumulating for years. And by the time symptoms appear, the arterial walls have already paid a significant price. Think of your arteries like the walls of an old house that has been under constant water pressure for decades. Not occasionally, continuously. Every minute of every day and every night. Over time, those walls develop small cracks, subtle weaknesses, areas where the structure is no longer as sound as it appears from the outside. And those weakened areas are precisely where the events that cause stroke are most likely to originate. This is very common after 60. Most people understand that high blood pressure is serious, but very few have ever had the actual mechanism explained clearly enough to feel the true weight of it. Here is the insight that changes everything. Blood pressure is not a fixed number that medication simply controls. It is a dynamic, daily response to behavior. It responds to sodium intake. It responds to hydration. It responds to sleep quality. It responds to chronic, unresolved stress. It responds to how much the body moves each day. A consistent daily walk, even 20 minutes. Adequate water throughout the day rather than waiting for thirst. Reducing processed and packaged foods that carry hidden sodium. These are not peripheral suggestions. They are direct interventions in the same biology that either protects or damages the arterial wall every single day. That is why you may notice that your blood pressure readings fluctuate meaningfully depending on the quality of the week you have had. That fluctuation is not random. It is the body responding to exactly what you just learned. Now here is where it gets interesting, and where most people are genuinely caught off guard. The heart and the brain are connected in a way that most people have never had explained to them directly. And understanding that connection could be one of the most important things you take from this video. There is a heart rhythm condition called atrial fibrillation. In a healthy heart, the upper chambers contract in a smooth, coordinated sequence that moves blood efficiently downward and forward. In atrial fibrillation, those upper chambers beat chaotically. Blood does not move through them efficiently. It pools. It slows. And in a small pocket of the left atrium, under the right conditions, it can begin to form clots. Those clots can travel from the heart directly to the brain through the arterial system. And when a clot reaches and blocks a cerebral artery, the result is a stroke, one that tends to be more severe and more disabling than strokes from other causes. Here is the warning that most people never receive clearly enough. Atrial fibrillation does not always feel like anything. Many people live with it intermittently for months or years without a single noticeable symptom. Sometimes the first indication it has been present is the stroke itself. You are not alone if this surprises you. Most people assume that if something significant were happening with their heart rhythm, they would feel it. That assumption is not always correct. Any unexplained flutter in the chest, however brief, any episode of lightheadedness without a clear cause, any sense of the heart beating irregularly, even for a few seconds, these deserve a direct and specific conversation with your doctor, not a casual mention, a named, specific request for cardiac rhythm evaluation. That is why this conversation, initiated by you and informed by what you now understand, could be one of the most important medical conversations you ever have. Now let us talk about something that connects to stroke risk in a way that surprises almost everyone the first time they hear it made explicit: Blood sugar. Most people think of blood sugar as a diabetes issue, something that belongs in a separate category from heart and brain health, something to worry about only after a formal diagnosis has been made. But here's the example that makes the connection clear. Imagine the inner lining of your arteries as a smooth, clean surface, designed to allow blood to flow freely without friction or resistance. Now imagine that surface being gradually coated, year after year, with a sticky residue that makes it rougher, stiffer, and more prone to the kind of damage where plaques form and clots develop. That is what chronically elevated blood sugar does to arterial walls. And this process begins not at the point of a diabetes diagnosis, but years earlier, quietly and without symptoms, in the range that most people and many clinicians do not treat with the urgency it deserves. A 10 to 15-minute walk after meals has a measurable and direct effect on post-meal blood glucose levels that most people over 60 have never been told about. Eating protein alongside carbohydrates at every meal slows glucose absorption in a way that protects the arterial lining over time. Reducing refined carbohydrates and added sugars, not eliminating them entirely, but being genuinely intentional, supports the kind of stable blood sugar environment in which the vascular system can begin to recover rather than continue to accumulate damage. This is very common after 60. Most people understand that sugar is not ideal, but have never understood why it matters specifically for stroke risk. Now that connection is clear, and clarity is what changes behavior that actually lasts. Here's the strategy that consistently surprises people the most, because most people have never connected it to stroke at all. Sleep. Not sleep as rest, not sleep as a preference or a luxury. Sleep as the most fundamental cardiovascular protective process available to the human body, and one of the most consistently sacrificed without understanding the true cost. During deep sleep, blood pressure drops naturally. This is called nocturnal dipping, and it gives the arterial walls a period of reduced mechanical stress that they depend on for overnight repair and recovery. In people whose blood pressure does not dip adequately during sleep, because sleep is fragmented, disrupted, or cut short, that repair window is lost. Night after night, month after month. Think of it like a machine that never gets switched off for maintenance. It keeps running, but the wear accumulates invisibly until something gives. Beyond blood pressure, poor sleep drives measurable increases in inflammatory markers, in blood sugar dysregulation, and in the activity of clotting factors in the blood. Every single one of those effects moves the dial in the direction of increased stroke risk simultaneously. A condition called sleep apnea, in which the airway partially collapses repeatedly during sleep, causing oxygen levels to drop and the brain to partially rouse, is significantly underdiagnosed in people over 60. Snoring. Waking unrefreshed regardless of how long you sleep. Unexplained daytime fatigue. A partner noticing pauses in breathing. These are signals worth naming directly to your doctor. The practical steps that most reliably protect sleep quality are consistent sleep and wake times every day to anchor the body's rhythm. A sleeping environment that is genuinely dark and meaningfully cool. Reducing screen exposure in the final hour before bed, and avoiding alcohol in the evening, because while it may help with falling asleep, it profoundly disrupts the restorative architecture of sleep through the second half of the night. That is why you may find that everything else on this list, the blood pressure management, the blood sugar stability, the inflammation reduction, works better when sleep is protected consistently. Because sleep is not one strategy among 5. It is the foundation beneath all of them. The 5th strategy is one that most people intellectually understand, but emotionally underestimate. And that gap between understanding and genuine action is where stroke risk quietly continues to build. Chronic stress. Not the acute stress of a difficult moment that passes and resolves. The low-level, persistent background stress that most people over 60 have simply normalized as part of daily life. The worry that never fully switches off. The tension that lives in the shoulders and the chest and the jaw without ever being consciously identified as a physiological event with measurable consequences. Here is what chronic stress actually does inside the body. It keeps cortisol, the primary stress hormone, elevated for sustained periods, and chronically elevated cortisol raises blood pressure. It elevates blood sugar. It promotes vascular inflammation. It disrupts sleep architecture. It increases the stickiness of platelets in the blood, making clot formation more likely. In other words, chronic unresolved stress does not just feel unpleasant. It activates every single biological pathway that elevates stroke risk, simultaneously and continuously. The solution here is not to eliminate stress, which is neither realistic nor necessary. It is to build a genuine daily practice that downregulates the stress response consistently. 5 minutes of slow, deliberate breathing in the morning, inhaling for 4 counts, exhaling for 6, activates the parasympathetic nervous system in a way that has measurable effects on blood pressure and cortisol levels. A short walk in natural light. Time spent in genuine connection with people who matter. Moments of intentional stillness that the body is allowed to recognize as safe. These are not luxury habits. After 60, they are as clinically relevant to stroke prevention as anything else on this list. And they are available right now, without any prescription, without any equipment, and without any cost. 5 strategies: managing blood pressure with genuine daily intention rather than passive compliance. Recognizing atrial fibrillation as the direct stroke risk factor it is, and acting on the signals the body sends. Addressing blood sugar proactively through movement and intentional eating before a diagnosis forces urgency. Protecting sleep as the irreplaceable cardiovascular repair process it genuinely is. And addressing chronic stress as the measurable biological risk factor it actually represents, not just an emotional inconvenience. None of these require perfection. None of them produce results overnight. But all 5, applied with consistency and patience, build toward a genuinely different trajectory. Your body after 60 is still responding, still adapting, still capable of moving in a better direction than it is in right now. And the choices you make this week are part of that direction, whether you intend them to be or not. Have you noticed any of these risk factors coming up in your own medical conversations? Is there one of these 5 that surprised you or gave you something new to think about? Share your experience below, because what you share here matters, and someone in this community may find exactly what they need in your words today.